Does Big Pharma suppress natural remedies because they aren't profitable?
No.
I have seen Big Pharma suppress natural remedies. Back years ago, when St. John's wort became popular, Pharma researched St. John's wort and said it does not work for major depression. That was the headline news across the country. Well, herbalists knew that. It's not good for major depression. It never was. And it's good for mild to moderate depression. But that's how Pharma suppressed St. John's wort in that instance. But of course, just the lack of talking about natural remedies, that's a way to suppress it. Keep your doctors always thinking about drugs. Keep your doctors always prescribing drugs. Keep your patients always thinking about drugs in the ads. That's how you can suppress natural remedies. Natural remedies can be much more effective than drugs in many cases, and you have to have the diet right, of course, but there's this competition for territory, if you will, in the industries between natural remedies and Big Pharma.
That's the start to that question. There's actually a huge number of drugs that have natural origins. I'll think of a few examples. Aspirin's a good example.
Aspirin,
from,
yes.
I think, willow bark.
Yeah.
So because a drug comes from a natural origin, meaningless. Doesn't mean anything. And he's bringing up willow bark. I use a lot of willow bark in my practice. It's excellent for getting rid of pain. As a matter of fact, it actually heals tissue. And they're comparing it with aspirin, which doesn't heal tissue. Now, they both can get rid of pain equally. But if you take them both for 6 months, if you have a trial, one group takes willow bark for 6 months, then they stop it, they continue to get better. The people who take an NSAID or aspirin for 6 months and they stop it, they bounce back and they get worse, just like as if they had never taken it ever before. So in this case, willow bark as an herb is better than aspirin and NSAIDs.
That's right.
For thousands of years,
Thousands
people
of
took it
years.
and turned it into
That's right.
salves or ointments or whatever it was with the same properties. A chemist figured out, this is the active compound in the willow bark that's having these effects. If we modify it a little bit, it reduces the gastrointestinal side effect.
I've never had anybody have GI side effects from willow bark. And again, he's talking about this isolate, and all drugs have negative side effects. Every single one, because they are isolates. That's the problem. So this is a therapeutic dose of hawthorn, 2 pills. Look at that. It's 2 grams of dried hawthorn, and you're not eating a bushel full of weeds. And you're getting the whole plant, and it's excellent for the heart. I've used this for 20 years.
You just take the pill, dummy.
He just called you a dummy for taking herbs.
It's called progress.
Not progress. I think isolating chemicals from plant is a regression. And you have to have a really good diet to start off with. And supplements and herbs like this work much, much better as long as your diet is really good. Some people are so sick they need the isolates, and that's totally fine. They get the prescription drugs and they end up with the side effects, and they can prop you up as your health is declining. But these herbs are totally valid therapy, and more people need to use them.